Good morning, Santa Clarita. This is Tom Burton, the Orthopedic Program Manager with Providence Holy Cross Medical Center, and you're joining us on the Providence Holy Cross Health Hour from 12 o'clock to 1 o'clock every third Wednesday, coming to you from the KHTS studios here in beautiful Newhall. If you have not had the opportunity to stop over, windows are open into the studio. Be able to watch the shows as they go on. Find us on AM 1220, and you can catch us also on the hometown station, KHTS's app, which you can get for your Android or for your Apple phone. Make sure that you download it. I have it on mine. That way I can actually listen to the station anywhere outside of Santa Clarita. And being part of Holy Cross, I like to keep it on at my desk whenever possible, and the app makes that definitely a possibility. So, Holy Cross, a lot of the times, you think about the other hospital here in Santa Clarita, but Holy Cross being Santa Clarita adjacent and having been providing care since 1961 to the San Fernando Valley and all valleys surrounding, Santa Clarita is a big user of Holy Cross, where 30% of our patients are coming from the Santa Clarita Valley, and believe it or not, probably 30% of our employees are actually here in Santa Clarita as well. It makes it very easy for everyone to be able to get in, and recently had to have some work done myself, and the decision to possibly go down to Holy Cross was a very easy one. So I really do appreciate the fact that the location where Holy Cross is, sitting between the 405 and the 5, allows it to be very easy to be able to reach. And as of recent, if you've been following the show, we've had a number of different specialists on from a variety of different areas in medicine to talk about all the exciting things that are presently going on and that are upcoming, including Holy Cross being more prevalent here in the Santa Clarita Valley, and that is no better seen than with the Providence Medical Institute, I believe, moving in December, coming up to the corner of Valencia and McBean, and what you're going to end up finding is probably some of the best neurosurgeons in Southern California, if not further out. And that kind of leads me beautifully into today, because our guest, and believe me, we're excited to be able to have him here today, and more importantly, we're really excited to have him over at Holy Cross. Just a little something about him. I did his medical school at none other than Stanford, and again, I'm a Pac-12 kind of guy, so this makes me smile and tingle inside. Internships at the Mayo Clinic, residency for his neurological surgery was over at UCLA. So Bruin, as well as a dancing tree. Okay, and then over at Johns Hopkins for his fellowship in skull-based neurosurgical and oncology. It's a heck of a pedigree. Want to welcome to the studio Dr. Gianna.
Thank you. Glad to be here.
Yeah,
good afternoon, everyone.
So you've been with Holy Cross for how long?
4 months now.
For about 4 months, and getting busier.
It is. When I was sort of looking at opportunities, I was looking at other places in California, and Providence, Holy Cross has this great vision of not only serving the community but building a very strong program. And I was actually looking at some academic institutions at other places, but from speaking with the administration, the faculty, and meeting the colleagues here, I was very impressed with the vision that they had and what they're trying to build here. So I was very excited to join the team and be part of this initial transition to create a phenomenal program.
That's amazing. And you bring up something, the vision, it's something we had Dr. Bernie Klein on a couple months ago, and it's one of the things that has impressed me about Providence Health System in general is that they aren't looking to tomorrow. They're not looking at next year. They're looking 5 or 10 years down the line to try to assure that they're going to be able to meet the needs of what the community is going to be requiring and the surrounding communities, because that we're finding that with the way health is going, that there are pockets of specialty that we can't seem to provide, and Holy Cross is really starting to lead into that, and not only to lead into what's missing, but to try to initiate the care that's going to be required moving forward. And as we were driving up today, you had mentioned specifically some of the deeper brain type of surgeries. Now, and it's phenomenal because our listeners will probably be used to hearing about things with endoscopic approach and arthroscopic approach, but we would never look at it for brain surgery.
Right, and that was the main thing, that the focus really was patient-centered here, and the goal is to serve the community. You can be able to do most of the common cases, but also to offer some specialty cases and more advanced surgical cases, so the patients don't have to go all the way to UCLA or Cedars or other institutions. That's why they've made such an effort to recruit phenomenal neurosurgeons, including my colleagues. So a little bit more about myself. I did my residency training in neurosurgery at UCLA. I also did an infolded spine specialization and a radiosurgery focus as well. And then I did another advanced fellowship in neurosurgical oncology for brain tumors and spine tumors at Johns Hopkins. So I've been very blessed with the excellent training I've received. And the goal is to sort of try to create the program and offer these complex surgeries to patients so they don't have to go far away and to receive the appropriate care. Some of the cases that we've already done, one of the surgeries involved a brain tumor that was situated very deep in the brain. And to access this tumor, it's challenging because you actually have to go through normal brain parenchyma. What we were able to do was bring in equipment from across the United States, including a special navigation tube system, which would allow us to, in real time, visualize as we're inserting this tube and move the brain fiber tracts away and resect the lesion. The tube is inserted under MRI navigation, so we can actually see in real time as we're inserting the tube the trajectory that it's going and if you're actually going to reach the target. And after resecting the tumor, once we remove the tube, the brain actually goes back to its normal position. So you are able to resect tumors that are deep-seated without causing any significant trauma along the tract of the resection. These are the sort of cutting-edge technologies that we want to bring here. In my training, this was something that was just initiated at Hopkins. I know some of the other academic centers in California don't even have this technology. It's called the brain path. Mm-hmm. But this is just one example of many other complex surgeries that we are offering here at Holy Cross now.
That's absolutely amazing. To be able to do deep tissue without and have a tissue sparing.
Exactly.
And the one case that you were specifically talking about, the outcomes were tremendous.
Right. So, I'm very glad to be involved with the care for this patient, and I'm also very appreciative. There's a huge support system there. To be able to do this case, we needed a special imaging technology. We needed this equipment to be available, which required a lot of key members being part of the team and facilitating the whole process, getting the equipment, and also teaching the staff how to do these complex cases. And so far, it's been a great experience working with everybody here. Some of the other surgeries that we hope to start and we can do now is, patients who, let's say, if they have tumors near the motor cortex or near the speech part of the brain. Of course, those are challenging lesions because when you resect those tumors, you can leave patients with a deficit. So how do you maximize resection while preserving those eloquent areas of the brain? One of the safe ways to do that is actually to have patients awake. Once we have done the exposure, we'll wake the patient up so they can participate while we're resecting the tumor. That way we can identify where the key parts of the brain are, the areas that we definitely need to preserve, and also how we maximize resection without compromising those areas. There's no better assessment of how, if you're preserving function by having a real-time feedback as you're resecting the tumor. So these are called awake craniotomies. We can also offer these surgeries, endoscopic cases as well. So there are a whole, different types of surgeries that we're hoping to offer that normally you would only see at advanced, at academic centers, but now are fully available here because of the expertise and the team that we have at Holy Cross. So
that's amazing. Now this for the listeners and maybe a little bit for me as well.
Sure.
So you've got the patient awake. You've done a craniotomy. I'm assuming you do the craniotomy, then you wake them up.
Exactly.
And then now there aren't pain centers specifically in the brain, so it allows you to do what you need to do, and they're for the most part fairly comfortable.
Absolutely. And that's very interesting what you mentioned. So when we do the craniotomy, that's when we remove part of the bone, which we replace. And after we've done the exposure and opened up the covering around the brain, that's when we wake the patient up. And so during that part, during the exposure, the patient is asleep. And of course, we give a lot of local numbing medication so they don't feel anything. And when we're actually resecting the the tumor, that is when they're awake, because that's when we need them to participate to identify the key areas. But what you mentioned is true. The brain itself does not have any pain receptors. So as we're resecting the tumor, they don't feel anything. But what's interesting is before we even start the resection, we will stimulate the brain. And as we're stimulating the brain, they will notice their arm moving, which will help us verify that this is a key part of the brain. Or if the lesion is near the speech area, we'll stimulate and they'll have a speech arrest. So we'll know that this is the area we have to preserve when we're doing the resection. So we identify those eloquent areas before proceeding with the resection. And of course, they're not feeling any discomfort, as you mentioned, because the brain doesn't have any pain fibers.
That's amazing. And now I probably saw this on Grey's Anatomy or something where the guy's actually playing the guitar while they're doing the brain surgery.
Right.
And as soon as he was able to actually then play the song, they realized they're in the right spot. So
Exactly.
Now, on a similar note, I guess, is Parkinson's. I believe there's also doing deep brain stimulation to try to help control with that. Now, is that anything that you've been exposed to?
Yes, we did do that in my training as well, and it's something that we can offer here as well. Patients, not just for Parkinson's, but even for essential tremor, and it can be quite debilitating. And the patients can't even feed themselves because of these tremors. And patients who have failed conservative therapy or medications, or refractory to medications, or have side effects from the medications, that is certainly another possibility, where we insert specific electrodes in key areas in the brain that are very carefully mapped out. And as we stimulate those key areas, the tremors essentially disappear. And in these cases also, the patients are awake, so we can have them participate. So it's interesting, once we insert the electrode and we turn it on at the right frequency, we'll actually see the tremors dissipate. So we can verify that we're in the right location and the response is immediate. And you'd mentioned a patient playing the guitar, and of course, when you're placing the electrodes, you have to be very specific, because if you're off, you can have some weakness or some other deficits. And that's why you want to map those out and actually have the patient participate while you're doing the procedure, so you can verify that the placement was optimal.
That's amazing. Absolutely amazing. Now, we have a very wonderful, new, strong relationship that we have with City of Hope, and bringing a lot of the care that has become so commonplace at City Hope, but so unreachable for people who live in the Santa Clarita area, or people who are living in the west side of the valley and the such, because it's such a large distance to get to Doherty. City of Hope has now come to us, and we've been really lucky to have this relationship now where City of Hope is inside the hospital, also out in Santa Clarita, and where you are now going to be working with City of Hope as well. Is that a fair statement?
Absolutely. We have phenomenal oncologists, radiation oncologists who are part of the team that are affiliated with City of Hope. And really, when you're treating brain tumors, spine tumors, you'd really have to have the full team to be able to offer a complex care. It's not just the resection, but the other members are just as important in the post-operative care to really aggressively and effectively treat different types of cancers. And in fact, that was one of the reasons that I chose also to come to Providence. In addition to the vision of the hospital, is the affiliation with City of Hope, because my interest is in tumors. And in fact, we actually met with the neurosurgical faculty just this week about creating this vision and plan. And City of Hope is a great hospital. In fact, my mom received her treatment there. She had breast cancer, and she did receive her treatment there. So I definitely respect my colleagues there as well. But we're sort of establishing the same program here, and they've actually reached out to us as well. So we can offer those surgeries here, including clinical trials. So we're almost sort of functioning as a one entity. Patients can receive the same level quality of care here, so they don't have to drive an hour and a half to Doherty to receive the treatments, the surgical treatments. And that's the whole goal, and that's why they reached out to us, because it was inconvenient for the patients to drive the long distance. And I'm excited to be a part of that as well. So
Right, it's huge. The hospital is truly excited. They've always had a very strong oncology program, and then with City of Hope coming in, I think that it basically puts us to the nth degree in order to try to meet the community need going forward. And very exciting for us, because we can now extend Holy Cross's footprint into Santa Clarita to assure that all of the fine work that we're doing, and it's amazing stuff that we're doing there, that we can actually take that and bring it to Santa Clarita, which we're going to be bringing you well, I brought you to Santa Clarita today, but we're going to be bringing you to Santa Clarita starting up probably in, what is it, December, I think, when you guys are opening up a new office.
Absolutely. We're very excited about the transition and the move, and looking forward to being closer to the Santa Clarita community. I think it's going to be a great opportunity for us as well. And, that's the thing. Like I said, the focus has really been to serve the community, and that's why we're sort of branching out and establishing offices in Santa Clarita as well, so we're more accessible, and that's an important part. The other key thing is, since I've been here, I've seen a pretty impressive transition at Providence where, they are bringing in young minds, bringing in new technology, new equipment, surgeons from, different training programs, academic institutions, because it's not just important to offer excellent care, but also be at the cutting edge, and that's key too. How we treat tumors and other pathology has evolved a lot over the last 5-10 years, and it's designed to make the surgery safer. We of course do a lot of spine cases as well, degenerative spine, fractures, traumas, one of the ones that we discussed earlier. With technology, one of the things is when you're fusing the spine, when you're instrumenting, as you're placing the rods and screws, you want to do it safer. And in the past, you used to insert the screws with sort of landmarks in anatomy, which is important. As a good surgeon, you should recognize that. But now with technology, we can actually insert the screws with guidance, image guidance, so you can actually in real time see how you're inserting the screw, so you can ensure that's going in the proper trajectory, that you don't compromise any function, you don't hit any nerves, you don't hit the spinal cord. And it's very important when you're talking about patient safety and recovery. So with these advancements, the surgeries have become safer, and it's important to be on the cutting edge and offer this technology, and that's the commitment that Providence has shown that I'm very excited about.
Now, now that you said that with the guidance, now there was discussion of an OArm, and I know that that's coming up, coming into the hospital relatively soon. And that is something that you will be using, correct?
Absolutely.
Yeah.
So it lets us take scans in the OR, and it's low radiation to the patient. Not just that, but also, like I said, you can actually see the insertion of the screws directly, so you can actually determine your tract and place the instrumentation without, by reducing the risk to the patient. But it's not just the arm. Providence is also committed to getting additional equipment, and we already have some of the equipment. Currently, we have a different brain path system that we use, a brain lab system, to actually insert the screws. So there are a lot of options that we have already, and of course, we're bringing in new equipment as well. For example, the case that we just talked about in the beginning. So this equipment is available for all the cases, and that's the key part. That's why I said it's a whole team. It's a support system that's very important. It's not just the surgery itself, but all the planning that goes into it. And that's where you really need people who facilitate, and it's, the help at Providence Holy Cross has been tremendous in that regard. So
that's great. And the place does keep you on your toes too. As a trauma center, excuse me, as a busy trauma center, you're going to see an awful lot of stuff coming to you, right? So it never is boring.
Absolutely. I think just in the week that I was on call, I may have seen a gunshot to the head, a patient who fell off a third-story building, somebody who was unfortunately trampled by a horse. So a lot of severe accidents, and the best thing is, because I have such wonderful colleagues as well, we're always available. There's somebody available 24 hours for coverage, so that when these patients come in with severe injuries, we can offer the treatment efficiently, effectively, and we're there right from the start. So
that's fantastic. And it was just recently had the opportunity to join the NICU reunion, and with Children's Hospital coming on with us and being able to offer the same thing, on-site 24-hour care, to be able to not only take care of the kids, but also to take care of the parents. And that was one of the things. I skulked you online and saw that you have,
And what I was going to also say was that when you see these patients, when they come in with these devastating injuries, and after they're in the ICU, and it's a long recovery, but these patients eventually come back to the unit and to say thank you, and just to see them in the office, that's the most gratifying part.
Absolutely.
When you see that change and the recovery. So.
And nothing better said that I went ahead online and maybe stalked you a little bit, and your ratings are through the roof. and the commentary was exactly that, and everything that we knew as far as intelligent, but the part that overflowed was the kindness, the personableness, and the such that goes with it, and that was the piece that allows us to be the caregiver, what the patient would really require. We're going to be taking a small little break here. You're here on KHTS AM 1220, your hometown station. We're with Dr. Gianna. We'll be right back.